Hello there, welcome to your favorite health show every Monday to Wednesday, 10 a.m. to 11 a.m. here on Ebru TV. You're watching My Doctor Show and my name is Purity Museo. Now, TB or tuberculosis is the 9th cause of or killer disease in the world. World Health Organization has reported an increased burden for TB here in the country. Now, last year, about 169,000 people were diagnosed with TB. But unfortunately, about 85,000 only were able to be treated. This means that half of the patients went undiagnosed and untreated. Something important to note is that there are people out there who have TB. Most don't know about it, majority know about it, but they do not want to talk about it. Why? Because there is a lot of stigma that come with TB. Our topic of discussion today is TB or tuberculosis, and to help us discuss that particular topic, we have a panel of experts who will be demystifying especially whether there is any relationship between TB and HIV and AIDS. But before we get to our discussion, last Saturday, it was the 24th of March, 2018, and Kenya joined the rest of the world in marking World TB Day. This is a time where the global community rallies behind or rallies together to just see how to defeat this disease, an old disease that can be treated, but it's becoming an issue not only in the country but worldwide. So I happened to attend that particular event, and just before we bring to you what we were able to gather from that event that was held at Misa Ground in Komarok here in Nairobi, I just want to welcome all our viewers wherever it is that you are watching us from. You can be or you are welcome to be part of this discussion or part of this show today by maybe asking a few questions and sending us your comments. The SMS number is 20268 and the number to call in will always be displayed right on your screen. Or you can simply interact with us through our social media platforms. On Twitter, we are at Ebru TV Kenya, and the hashtag will always be My Doctor. And you can also talk to us through our Facebook page. We are Ebru TV Kenya. Before we start our discussion today, let's have a look at what happened on Saturday at Misa Grounds, where Kenya was joining the rest of the world in marking World TB Day. Take a look. All right, so we are here in Komarok in Nairobi, Kenya's capital city, where the World TB Day is being celebrated, and some key issues have come out that TB is the leading cause of death in the world when we are talking about infectious diseases, and in Kenya is the 4th leading cause of death. Now, a high burden of TB has been reported here in the country, and here we are talking about 29,000 people dying annually. So we are going to talk to some of the key stakeholders here in this event. We have the CS for Health, Cicely Kariuki. We also have representatives from the World Health Organization as well as the U.S. Ambassador for Kenya, Bwana Godek. So we are going to have a look or talk to them and hear what they have to say in regard to what ought to be done to reduce the numbers and also to find the missing cases that are yet to be diagnosed. So follow me. So with me is the health CS, and we just want to find out what she has to say about the increasingly burden for TB in the country. Thank you so much for having us, and maybe we've just seen that the burden is really high for TB in the country. What is the plan for does it really worry you, and what's the way forward now?
Well, everything that is not working right should worry a CS for Health and my team, and it is true the burden out of TB is high. And that is not to say that we have not been doing a lot. A lot has been done, but like I've indicated, a lot more requires to be done. One, it is exploring the possibility of bringing within the National Hospital Insurance Fund a TB cases so that that can be covered and so that the burden in line with the UHC can be minimized in terms of the financial burden to the patient. Number two, there's a conversation which needs to be around all of us in terms of awareness raising. A lot of Kenyans out there are exposed, and therefore any one of us, you and I, can actually be infected with TB. And awareness to the extent that if you have prolonged a cough, 2 weeks plus, fever and other symptoms that lend themselves to TB, you need to go to the closest health facility to be checked. And this is where the media comes in with a partnership that then you will be able to help us in getting these messages out, but also to the communities, that some of us who already have an idea what TB symptoms would look like to encourage us to go to the health facility to be checked. From where I sit, we have several partners working with us in the TB space. It is to encourage them to continue partnering with us, to bring in more resources that will then be directed to this cause. Importantly, the conversation about TB is really not about the Ministry of Health alone. We have issues of ventilation, we have issues of housing, you have environmental issues that really fall within other mandates across the government. And so again, it is my responsibility to summon support from these other institutions and ministries to be able then to be sensitive to this growing concern and to be able to partner with the ministry.
And so for a comprehensive discussion, and we're going to discuss all there is about TB, do join me in studio with a panel of TB experts for more on my Doctor Show. I'm Purity Museo. And that's exactly what we are talking about today with a panel of experts. Remember to be part of this discussion by calling us in. The number to use will always be displayed on your screen. The SMS line is 20268. And maybe to introduce my guest, right on my left is we have Elizabeth Mweni.
Yes.
Yeah, she is a TB expert, and at the same time she is a coordinator for TB in the county of Nairobi. And next to her is we have Dr. Kamene Kimenye. She is the head for National TB Leprosy Lung Disease Program under the Ministry of Health, right? Okay, welcome both of you to this discussion.
Thank you, Purity.
Yeah, we will be looking at, because both of you, I'm happy you were at that particular event that was at MISA. I saw both of you. And so before we get to the guidelines, we just want to guide our viewers on TB. When we talk about TB, because there is a lot of misconception about TB, what's the difference? Many people may want to ask, what's the difference between TB and just a normal cough? So maybe, Elizabeth, you could take us through what really TB is.
Thank you, Purity. TB is an infectious airborne disease that is caused by a bacteria called Mycobacterium tuberculosis. And you can always get TB through inhaling the bacilli. So one of the common, in fact, the most commonest signs of TB is a cough. Yeah, that's why we are screening all coughers for TB. Yes, so it's a bacterial infection which is infectious and is spread through airborne.
Right.
Yes.
And last week we were talking about asthma, and it has, let's say, almost the same explanation. Maybe, Kamene, how do you differentiate TB and other diseases that come with coughing?
So when you're talking about TB, apart from the fact that it's infectious, you want to ask someone, have you been with someone who's been coughing? Asthma most likely will start, the onset is usually very brief, like by yesterday and today you are very sick, but TB takes a longer period of time. That's why previously we used to say a cough of more than 2 weeks, but with asthma it will just be a day or two, so it's usually shorter compared to TB. TB also comes with other signs, like you're losing weight. You'll also find that you're sweating a lot at night. And when you cough, what comes out, we usually call it sputum. Kikohozi, you would call it kikohozi in Kiswahili, might have some blood. So there are many ways of making sure that you differentiate the two. However, anybody who is coughing coming to the healthcare facility, whatever condition they have, whether asthma, pneumonia, a cold, we want to screen them or test them to just find out they do not have TB. Because for us, you'd rather, first of all, put on treatment as you look for other problems that you might be having.
And maybe how do you screen for TB, Mweni?
Basically, there are the 4 common signs that we usually ask. Have you been coughing? So any patient that they're coming to the hospital, they've been coughing, that is one sign of TB. Fever, if they've been having fever, very important. We screen for all the fevers for TB. Chest pain, those who come with respiratory infection, they have chest pain, that's another sign, and weight loss. So those are the key major signs for TB. And we screen, in fact, in all our department for TB, and we ask those questions. Even our children, those who are malnourished, they're not gaining weight very well, they are also screened for TB. Because malnutrition is one of the key signs of TB among the children.
Right.
Yeah.
And maybe why is it important to screen for TB?
We want to get TB as early as possible. You know, we don't want the patient to come very late when it's so obvious they have all the signs of TB. We want to get these cases as early as possible because we'll be able to prevent. As I said earlier, TB is an infectious disease because we all breathe the same air. So if we get these cases early, we are preventing also others from getting TB. So we want to get the cases as early as possible and put them on treatment. Putting them on treatment, get them early, we prevent others from getting TB. Yeah, so it's very important, and it's one of the key areas. We want to get the cases as early as possible, not late. When the signs are obvious, they have spread a lot of TB around the community. Yeah, so we want to get the cases as early as possible.
And maybe, Kamene, someone may be asking, why should I even get treatment for TB? Why should I go ahead and know my status, whether I have TB or not? Maybe you could let our viewers understand how bad it is to have TB.
So knowing what the disease you have, first it's important. One, you will be cured. For sure, if you start your TB treatment, your chances of being cured are very high. And your treatment is free. We are going to just make sure you get your drugs. But why do you need to know whether you have TB? You live with people in the community and you have your loved ones in the house. I'm sure you do not want your loved one to also have a condition that if you had been treated for, you'd not have been you'd not have spread it to them.
Right.
So first is not just for you to get well, but also for others to protect your family. The second thing is that the longer you wait to start treatment, the more TB becomes complicated. For example, your lungs may start to collapse. You may start having fluid in the lungs, so breathing becomes a problem. You may start also having heart complications. In medical conditions, we call them col pulmonale. And many other things that result from having TB. Then you start losing weight and you start wondering what is going on. So instead of having to wait until you have all the complications that result from TB, it's better you start your treatment early, you get cured early, and you also protect your family.
All right, and maybe you're joining us for the first time. We are talking about TB or tuberculosis, and in studio is a panel of 2 experts. They are demystifying. I can see your questions coming in, and yes, we will be demystifying for you whether there is any relationship between TB and HIV and AIDS. The SMS line is 20268. The number to call in will always be displayed right on your screen. Okay, so she's talked about the complications that come with TB. Maybe you could let us understand, because we have so many diseases that, like we had said earlier, that have the same symptoms as TB. Maybe what are how do I call them? But what are the real symptoms, or these symptoms that once I express, I'm able to say, I think I have TB and I need to go for checkup?
Cough. And we're saying cough of any duration. And you know, these TB signs and symptoms mimic other respiratory infection. So what we are even advising our viewers and even our people back at homes and community, if you're having cough, it's better you go be screened for TB. Yeah, because I know other signs, even asthma, as Dr. Kamene has said, they have a cough. Yeah, so it has all the signs of respiratory infection. So if you've been having a cough, for any duration, it's very important. You go check up for TB. Chest pain, very important. Losing weight, unintended weight loss, very important. That is one of the key signs for TB. Then night sweats, and not normal night sweats. You sweat until it's drenching night sweats. That is a major key signs for TB. Yes, and fever, because it's a bacterial infection, you get fevers, intermittent fevers on and off. Yeah, so the key signs is cough, because you know it loves the air, and the lungs are the primary site for TB. So you'll start coughing as the first sign, even if you have TB of outside the lung. Yes. All
right, Kamene, for other diseases, we usually have a class of people that are at a risk of getting, let's say, diabetes. Let's say there are diseases that affect children, and there are other diseases that really affect adults, or even we're talking about age, we're talking about gender. Do we have gender or even age disparity for TB, or anyone can be affected by this disease?
An interesting question. TB mainly, of course, affects people who have lower immunity. Maybe if I can go back a bit. How TB, as Mweni has mentioned, is transmitted is I just need to sit with someone who is coughing, and that person coughs, and I just breathe in the bacteria, and I get it. I don't immediately get the TB in most cases. But when my immunity starts to go down, then TB now becomes active, and I have now TB, what you will call someone has TB, akona kifua kikuu. Yeah? So in what circumstances is this common? Of course, HIV has been for a long time the biggest driver of TB. And for the reason has been because of the immunity. When you have HIV, your immunity goes down. This, let me first alleviate the fears to the Kenyans that HIV patients have been lacking. We have put in a lot of efforts in ensuring that anybody who has HIV is screened for TB. And as we have done that, we have noticed the decline of TB among those people who have HIV. And it is, there was a time we were saying if you have HIV, you're most likely having TB, but this time, no. If you have TB, you're not most likely to have HIV. So, but if you have HIV, we have to screen you. Right. That's important. And if you don't have TB, we'll put you on preventive therapy to make sure you don't develop the disease. If you have HIV, be screened for TB. I think that's important that I underline that. Other factors are diabetes. Diabetes also reduces immunity in people, and they also develop TB. More likely to develop TB. Other people are more likely to develop TB, or maybe I might say people who have developed TB according to the prevalence survey that was completed recently. It showed that you're more likely to have TB if you're male than if you're female. And this was more among young men between the age of 15 and 34. That age group usually will have more TB than the other populations. Among children, if you're exposed and you're less than 5 years old, in other words, if you're living with someone who has TB and you're less than 5 years old, you have a high risk of getting TB. Right. The prevalence survey also showed that there's the population above 65, especially women, have more TB. But it might also be possible that there are fewer men at that age group. Yes, but it was noted that at that age group, there are more women with TB. Yeah.
And we will be getting to know why more women than men. Remember to talk to us. The SMS line is 20268. We are talking about TB, some of the causes, and why it's important to go for that screening. You can as well call us in. We will have a whole session to respond to your concerns. Then the call line rather will always be displayed on your screen. So we have seen, she's talked about people who are at a risk of getting TB. We never used to hear cases of TB among children, but right now there are cases that are coming up. Maybe what leads or what causes TB?
Oh, thank you, Purity, for that. And I'll say that among the adults, we usually say if in an adult population, 10 to 15% are supposed to be children. Yeah, because of the infectiousness. You know, children have few bacilli. They don't transmit the bacilli to others. Right. So basically they get it from the adult. And you'll find that if an adult has been coughing and they've been diagnosed to have TB, in that population you need to look at if they are children, we also screen for them for TB. And if you get a child who has TB, just know there's an adult who has been the primary source of that TB. You need to look for the source. Yeah. So we have been doing a lot of screening among our children. That's why we are getting children now, because the population of the adult with TB is very high. Then the children now, that 10 to 15% has also increased because of the adult population that is having TB. Yes. And
Kamene, there's usually a lot of fear that comes with screening. When it's about screening, no one wants really to turn up. Is there a way you can, or we can tell that, or is there a way I can tell that, you know what, I think I have a TB without even going for screening?
Okay, let's deal with the fear.
Yes.
I think the first problem why we have fear is because for a long time, people who had TB assumed that I have TB, most likely I have HIV. And so for that reason, they were afraid to find out, could I be having HIV? But now the prevalence survey showed 83% of the people who are having TB do not have HIV. So it is now safe for you to go and just get without the fear of HIV. 1. 2, if you have, you're coughing, you must be screened for TB. The reason is we want to be sure that what you have is not asthma, it's not pneumonia, it's not, but it is TB, so that we can put you on treatment. I would say another problem why people are not going for screening is lack of knowledge. We can actually bear me witness today. In the village, when you go and someone is having a fever, they say I have malaria. So almost everybody has heard about malaria. If you see someone losing weight, even if it's intentionally, they start saying, hey, could it be HIV?
Right.
So almost everybody has heard about HIV. But how many people know about TB? How many people know when I cough, it could be TB? When I cough, most likely I'll go for a cough syrup. Or I'll go and take mitishamba or something. Because all I want to do is get rid of the cough. So the bigger reason why people don't go for screening is because they do not know that they could actually be having TB. So they just assume it's a cold or just the usual things. Yeah. So we need to create awareness so that we can deal with that and allow, so that people can also know. And not just for the people, but also for the healthcare facility. That healthcare workers, when they see people coming in, they are sensitized and they are sensitive enough to ask, could you be coughing? Could you be having a fever? Could you be having night sweats? And could you be losing weight? Yeah.
And I think we'll also be really delving into addressing those fears, especially demystifying whether there is, how do you convince someone with a TB that chances are very high that they are not even HIV positive. But before then, maybe you could tell us, or you could take us through how TB is spread.
Okay. As I said earlier, TB is spread through airborne. It's an airborne disease. So when you inhale the bacilli, if I'm coughing for now and maybe I have the TB disease, if I cough, you inhale the bacilli. Then when you inhale the bacilli, they go to your lungs. Yeah. Now, depending to your immunity, the bacilli can be contained in the chest, then it remains for many years and it can be killed by your immunity.
Right.
But if your immunity one or another goes down, the bacilli now wakes up and they start multiplying. So it all depends. The young children, immediately they inhale the bacilli because the immunity is very low, they become infected very fast. So basically, it's through the air. If you inhale the bacilli, you can get the infection, which later on end up to having the disease. Yeah, but not everyone have the disease. Most of us have inhaled the bacilli. In fact, if you're living in Nairobi, Nairobi is one of the high burden cities in Kenya. We have a lot of patients. Last year we diagnosed over 12,000 TB cases. In the matatus, you are breathing the air. We are staying with people who are infected with TB.
That's true.
Yes, but you're not becoming sick. Yeah, some of us work in the hospital. We have handled this patient, but because your immunity is very high, it contains the bacilli, and after some time, it kills the bacilli. But when one reason or another, your immunity goes down, the bacilli wakes up and start multiplying, then you get the disease. Yes.
And maybe, Kamene, in regard to what she's saying, she's talking about how it's spread and all that, but is it possible to be diagnosed with TB? Okay, I'm sure it's not really possible to live in an environment where someone is not infected, but do we have some genetical factors to this?
Rarely do we describe the genetic attributions to TB. Most of the time, what you're most likely to get is just immune responses. How is your body responding to a disease? Yeah. But we rarely talk about any genetic infection because you have to first of all get the disease, and then after you get the bacteria in your system, and then depending on how your body will respond in terms of immune response, then you develop disease or not. Generally, most people do not develop disease in their lifetime.
Right.
Yeah, because their body is able to contain that disease. Only when your immunity goes down does it now become an issue.
And this year's theme had to do with Mulika TB, Maliza TB, and Nijukumu Langu.
Yes.
And so how, because it's all, from what you two are telling me, it's all about immunity. It's all about how, first of all, how do we Mulika TB and Maliza TB?
By coming, screening, very early screening. If you have neighbors, you have had neighbors who are coughing, maybe you are in your own house, people are coughing, sorry. Please come to the facilities, check your TB status. It's very important. We are saying we are doing active case finding, and we cannot do active case finding at the facility alone, even at the community. If you get people who have been coughing, kindly come and ask to be tested for TB. It is, we want to mulika. We want to guess. From what Kamene has said, we did the prevalence survey, and we saw that we are having a lot of missing cases. So we want to mulika all the cases and get these cases as early as possible.
Right.
And it is everyone's responsibility, not only the healthcare workers.
Would you allow me to pick a call?
Okay.
There's someone who is calling. He's John from Tana River. Let's hear what he has to say. Hello, John.
Yes. Yes.
Hello, John.
Hello.
Yes, I can hear you.
I am saying sometimes you don't cough. You feel like coughing.
Right. Yeah.
And the system is not clear. The breathing system.
Yeah.
And you have some pains in the back. But if you go for screening for TB, it is always negative. What could it be?
Okay. Thank you, John. You heard what John is saying. Sometimes you want to cough, but it's not coming out, and then you have some pains at your back. What could be the problem?
Should I
Yes.
attempt to answer?
Yes,
Okay.
yes.
I'll just say there are two major types of TB. We have the one which is pulmonary TB. This is the TB of the chest, the lung field. And it's the most infectious type of TB because you cough it out, you remove the bacilli. Yeah. Then we have extrapulmonary TB. Extra is outside the lung cavity. And TB can affect any part of your body apart from the nails and the hair. Yeah, so you can even get TB of the spine, the back, yeah, TB of the abdomen, TB of the heart and the brain, and so forth. But you all have to inhale the bacilli. So different type of TB outside the lung present differently.
Right.
Yeah, you don't have to have a cough. Sometimes you can have, like he's saying, maybe he's having a back pain. Yeah, and maybe, yeah, he was coughing and is not removing the sputum is not productive, so we cannot get sputum. He can get even X-ray. X-ray of the back, through looking at the X-ray, we can tell if it's a TB of the spine. It can always be shown, but mostly the TB of the spine, it loves the bigger bones because, you know, TB loves the air. Yeah, so it will not attack the small bones, it will attack the bigger bones where at least is well aerated. So depending on where the site is, even if it's the abdomen, you'll have specific signs for the abdomen, which maybe sometimes it's hard to diagnose, not like the TB of the chest, which when you remove the sputum, it's easy to diagnose, it just be checked, then you get it. But outside the lung field, sometimes we have to be more vigilant, we have to be more aggressive in looking for TB, which is outside the lung field. Yeah.
And we'll continue this discussion very shortly. We want to take a very quick break, but when we come back, we want to have a look at, is it possible to go for screening and you have TB, but it's not found? We will answer that question when we come back. Thank you so much for being part of this discussion. That was the very first half of My Doctor Show. We are coming back, and when we come back, we will be looking at treatment for TB, among other things. We'll also be looking at your comments and feedback. Do stay with us. Welcome back. In case you're joining us for the first time, my name is Purity Museo, and this is My Doctor Show. We are talking about TB, and unfortunately, Kamene had to leave us, but joining us here is Eliud Chichi. He is a survivor, but he tells me not to call him a survivor because nowadays they are champions, right? So welcome to the show.
Asante.
Yeah, and we were talking about TB. We've looked at some of the causes. Maybe we could start with you, Eliud, because you are a champion. Let me not call you a survivor. Maybe you could just tell us, how was it like for you? How were you diagnosed with TB? When did you get to know that, you know, I have TB?
It was a little bit challenging those years because mine started early 90s. And I think people had no idea, had no education, you understand. So I started coughing 1996, visited private facilities, of which they were treating pneumonia. Nothing was done as test examinations, you know. Once the doctor just used what they call it?
The stethoscope.
Yeah, that's what he used, you know. So I was put on antibiotics until 1990, 1996, 1997. I had the doctor mention Rifata. By then I used to take 8 drugs. They were not compressed TB drugs like the ones being used now. Those times was so. I didn't know what Rifata is. Mine was just paying, getting the medicine, going home. So the cough never stopped till 1999. This is when my mother advised me I should visit Portrees. Portrees Hospital, that's the only facility in Mombasa which used to handle TB cases. And so when I went there, they did an X-ray. And I was put on injections with 8 drugs I'm talking about. So I went for injections for 2 months. Then they changed, but it never worked. I don't know why.
All right.
So I did it second time. Then I decided I go back to the doctor at the private clinic. He continued messing up. So I shifted from, because my profession, I'm a DJ, and I used to be a diving instructor.
Right.
So I had to stop diving because of, it needs a lot of air in the lungs.
Okay.
So I stuck to the DJing, but coughing and coughing, I was not comfortable. And at the same time, I was losing weight. I was 78 kgs, and I was going down. So it was a little bit difficult for me. Then I have to move from Mombasa now. My mother comes from Taita. I went to Voi.
And Chichi will be looking at how it was like for you. Maybe did you get any kind of stigma? We'll be talking about that very shortly. We first want to have a look at some of the home remedies for this particular disease. But remember, when we come back, we will be having a look, or we'll be reading your comments. We'll also be answering to some of your questions. Keep talking to us. The SMS line is 20268, and you can also feel free to call us, because the call line will always be displayed right on your screen. Take a look. Welcome back. You are watching My Doctor Show, and today we talk about TB. And in studio we do have Eliud Chichi. He is a TB champion. We also have Elizabeth Mweni. She is a TB expert, and at the same time she is a TB coordinator for Nairobi County. So he's talked about what he's been going through. Maybe Mweni, you could briefly, because he's mentioned about misdiagnosis that he went through so many hospitals before he could get the right place to go. Maybe what is the treatment for TB, and why do we have, what are some of the centers that we have here in the country? Because we're getting claims of you going, you're diagnosed for a different disease. How do we even address that?
Thank you, Purity, for that question. I think from Chichi's view, a long time ago, there were very few facilities that were treating TB. And you can see that he had mentioned Portrees at the coast. I know in Nairobi used to have Mbagathi, which by then it was called Infectious Disease Hospital, but now it encompasses all type of diseases. We have decentralized our centers to the lowest dispensary. They can treat TB. Even when you go to the small facilities in our counties, they have the knowledge of diagnosing TB disease. So it's not a must that you go to Kenyatta. Even the small periphery facilities, we have empowered our healthcare workers. They have the capacity and they are able to diagnose TB. I know there's some instances, as I said, extrapulmonary TB, which is a bit hard to diagnose, not like the pulmonary, the one people who have been coughing, it's very easy to diagnose. But if it's outside the lungs, sometimes it will require maybe a series of tests or a series of high index of suspicion so that you can see this one could be TB. But pulmonary TB, even at our lowest facilities, nowadays we have trained our health facilities. They are able to diagnose TB.
All right.
Yes.
And just before we get to hear from Chichi, let's have a look at some of the questions here. Do you think when I'm having a smelly mucus, it may be TB? Let me read another one. Can the doctor clearly explain the people who have a TB without AIDS are people with a low immunity? The relationship between TB again and AIDS. So maybe you could respond to those two first.
Okay, thank you very much. Smelly sputum, if I got it right, it has to go through the lab. You know you cannot diagnose TB by just looking at your sputum. It has to go through the lab where they look for the bacilli. Yeah, if you have that smelly sputum, just go and ask, request for TB diagnosis. They'll take the sample, take it to the lab, then they'll examine. If it is not TB, then you'll be given, or there are other factors that we can look for and see if maybe you could be suffering from TB.
All right.
TB and HIV, it's
Yes.
misconception. And I want to say one important thing, especially the infectious form of TB. That is the TB of the lungs. Yeah, most people, in fact 70%, like in Nairobi, we have 69% of those patients with TB are HIV negative. You know, now when you breathe the air, the bacilli, your immunity is very high. It wants to contain the bacilli to stay in the lungs, not to spread to other areas of your body. So mostly, if your immunity is very high and it contains the bacilli in the lungs, maybe one or another, your immunity went low, yeah, due to nutrition and other forms of infection, that bacilli will wake up and start multiplying.
Right.
But if your immunity is very high, it will remain and contain inside the lungs. Yes.
Maybe we can get another one. Do you think when I'm having, I think it's the same question for smelly mucus.
Yeah.
Hi, I'm watching your show from Lenana. Thank you very much. I'm 24-year-old lady. I am a former TB patient. And no, I don't have HIV. But during my treatment, I experienced some problems. The question is, my question is, does the anti-TB, I think, cause nerve problems and sometimes ulcers?
Oh, those are the side effects of
Right.
the drugs. Yeah, we have, you know, even Panadols, they can give you side effect depending on how you take it. Our drugs, some have side effect, and the common one is the one the viewer has just mentioned. We usually have peripheral neuropathy. Basically, that is the pinning sensation in your legs and your hands. You feel like you can't walk. You are feeling so numb at your legs. Reason being, one drug that we use in the treatment of TB is called isoniazid. And when you use isoniazid, it depleted some of your vitamins in the body. Yeah, especially the vitamin B. Vitamin B6 is one which is usually depleted. That I say nutrition is very key. We cannot give you drugs and you're not eating very well. So in fact, when we give you this drug, sometimes we give you a medicine to counteract the effect of isoniazid.
Right.
So we give you supplement called pyridoxine that will counteract the effect of peripheral neuropathy, the needling sensation of your hands, your legs. Sometimes if it's for the young ones, children who are crawling, they refuse to crawl. If they are walking, they refuse to walk because they are feeling the burning sensation of the legs, they cannot walk. So those are some of the side effects that we get. Others is pain on the joints. Yeah, you feel like you're having joint pains. One of the drugs sometimes give that joint pain. But if you feel that, don't just stay at home. You come, we give you medication so that at least you continue with your treatment and you don't stop at that.
All right.
Yes.
There's a lot of stigma that come with TB. Chichi, maybe from your own experience, how was it like for you? Did you get stigma from maybe your family, your friends, your workmates? How was it like for you?
And mine wasn't that heavy, but it was there because coughing was like my lifestyle, you know, and wherever I pass, some people say, huyo anaenda, is going, you know, they misunderstand. You know, what they used to think is coughing is HIV. You understand? So stigma, I've experienced stigma, not only outside, even in the health facilities, because once they realized that I developed a resistance, because after just 2015 is when I realized that I was resistant, and the treatment was not yet on here for drug resistant. So I had to live on like that, you know, controlling. But all the time I used to be at the facility. But lucky enough, the doctor was handling me. In Voi, he was so kind, you know, he understood how I'm moving. And so there was not much stigma, but after treatment is when I'm getting too much stigma, you know. Because when I go to a facility and mention that I was in this situation, you know, things are happening. Really? You know, people running for masks and you know, forgetting that it's better I have introduced myself that I was there. What about those who are coming in there, you know? They are coming, they are fresh, and you don't know about their coughing, you don't know their status, you see.
Right.
So,
and how are you doing right now?
I'm still struggling because, you know, I'm doing, through my journey for treatment, I started doing advocacy, you know, going to the clinics, empowering patients, you understand, giving them health talks. It is in schools and everywhere. I'm using my situation in education. And so how I'm doing now is I have a collapsed lung, I think, what you
Yeah.
call it. So it makes things difficult for me because it's getting infected. Infectious diseases like bacterial, fungal,
Right.
pneumonia. You see, so I'm losing air sometimes. So most of the time I'm back at the hospital, Kenyatta, get some treatment.
Yeah, and we pray that you're going to be completely okay. Yeah, and there's an issue of stigma that has come up, and we, from the World Health Organization latest report, it's that 83% of TB cases are not even related to HIV and AIDS. So how do we address the issue of stigma for TB patients?
In fact, from what Chichi has said, and I think maybe you never got it clearly,
Yeah.
he had the resistant pattern. He has
Yes.
suffered TB for so long. And you know, people usually fear the resistant pattern.
Yes.
And they know TB is infectious form of way because you have to breathe it in. We have done a lot of sensitization. I think public awareness is something that is very key, and we need to work very hard on that area. It's not all issue about HIV. It's the issue about being infectious and scared of getting TB from that perspective. So in our health facilities, I think we have done a lot of health education. There's still a bit of fear because of the infectiousness. We have had healthcare workers who had gone down with a resistant pattern of TB, and which is not good. Chichi will tell you he was on treatment for 2 years for the resistant type of TB. HIV and TB, I think it's something that we need to do a lot of public awareness.
Right.
I think there's a bit of gap, but there's a little relationship, not too much. I think nationally last year, only 27% of our patients were HIV positive. Most of it were HIV negative. So when you have TB, it doesn't mean that you are having HIV. No. But we'll screen for you for HIV so that we can manage you better.
Right.
If you have both two diseases, we want to manage you better. But if you're negative, we advise you on many other things on that. So I think it's something that we need to work hard on it and educate the public that it's not a must. When you have TB, you should have HIV.
All right,
Yeah.
and maybe to make it clear to our
Yeah.
viewers that why, because many may be asking why, if for example I have TB related symptoms, and why do I have to be, you know, screened for HIV? Does it have, because what I understand is that when you have HIV, it means that your immunity is low and you're prone to getting many diseases, right? TB being one of them. So basically there's nothing to worry about.
But one thing I'll want to tell you why we test our TB patient. I'll tell TB is one of the opportunistic infection in HIV world.
Right.
Yeah. You find, in fact, most of the people, maybe they didn't know their HIV status. When they got TB is the time they're knowing their HIV status.
Right.
So we are trying to screen our patients who have TB for HIV to see if we can manage them better, because TB is one of the major opportunistic infection in HIV. Yeah. There's a bit of relationship, but it's not a must that if you have TB, you should be having HIV.
And
Yeah.
there's a very interesting question here
Yes.
from Moline from Kariobanki South. Apart from this TB being spread through air, how else can someone be infected with this disease?
No, it's through airborne.
Right.
Even if you have TB of the skin, you have to inhale the bacilli. I think maybe it never came out clearly.
Right.
You have to inhale the bacilli, then your immunity tries to contain the bacilli to stay in the lungs. If your immunity is not that well enough, sometimes the bacilli slip off into the blood, then it goes into different part of the body. You can get TB of the skin, TB of the abdomen, but it's through the inhalation of the infected bacilli. Yeah. So it's the only way that you can get TB. It's through inhalation.
Yes,
Yeah.
and Chichi, you've talked about moving from one hospital to another. Maybe you could take us through how was the treatment for you, like in terms of the cost? Was the cost for treating your condition friendly?
No, it was because on the private facilities I used to pay.
Right.
To pay really good money.
Yes.
And the antibiotics, drugs are expensive, of course. So I used to spend maybe 18K, you understand, a week. So, but TB drugs are free. When I was put on diagnosed and put on TB drugs, I used to buy maybe few, because when the culture results came showing that I was resistant to 3 drugs, but that's the time when doctors and coordinators from all over Kenya used to come here and have a meeting at the TB, National TB Control. So Dr. Musia, his name was Dr. Musia, he's is Dr. Musia, used to communicate with by then Dr. CTNA. So he advised him to combine the TB drugs before, because the resistant treatment wasn't available in the country. So he used to combine with the sparfloxacin. So I used to buy sparfloxacin every week, and it's a costly antibiotic.
And maybe, Chichi, from your own understanding, that time when you were diagnosed with TB, did you really know what had caused your situation, or what did the doctors say had led to that?
No, that's why I'm saying those time information wasn't there.
Yes.
And until now, still now, some parts there is no information.
Right.
You understand? Because in the past several months I've assisted other people, taking them to the facility at Kenyatta. They were diagnosed and found having TB. That they go back to the church, and you see the church, the pastor advises that you should quit drugs, let's pray, you see. So there's still a problem, you understand, on education. On making people understand. So I had no knowledge that time, but now I'm fully equipped.
Right.
Yeah, I know everything about TB, I know everything. Because through this journey, I gained education, I gained everything, knowledge.
And so, Elizabeth, you've said very well that it's an airborne disease. So we are not talking about lifestyle here.
No, lifestyle, I think your immunity, there are some risk factors which reduces your immunity, as we have said earlier. If your immunity goes down, the latent bacilli will wake up and you can get the disease. Yeah, so it depends. If you live in an overcrowding place, you are able to inhale, maybe where people are coughing a lot.
Right.
Yeah, poverty is also one thing, because maybe nutrition, you cannot eat very well, and you know, lack of nutrition, if you don't eat well, your immunity goes down. So the latent bacilli that you have inhaled can wake up and start multiplying.
Right.
Yeah. The children, I've talked about the children, their immunity is very low. They cannot contain the bacilli once they get the infection, so directly it becomes the disease. Even the old, the immunity is very low. Yeah. Even other infections like cancer, autoimmune diseases, where they reduce your immunity. We have talked so much about HIV. And I know when Dr. Kameno was here, she talked about diabetic. Diabetic also reduces your immunity down, so the bacilli can wake up. Yes.
So what do we need to do? How do we prevent its spread?
It depends, basically. There is the facility and the community. Prevention of TB is everyone's responsibility. I cannot do it alone. Yeah, when you're in the matatus, when you're in a matatu, you need to open the windows so that you can get the free flow of air to prevent, because it's an airborne disease. When you have good circulation, it is very important. Back in the houses, maybe this is a TB patient. If you have been sick, you don't cough anyhow. Yeah, cough etiquette is very key and critical. You need to ensure that you close your mouth when you're coughing so that the bacilli, they don't go spreading out. And in the house, we advise our patient to spend a lot of time outside the home, outside the houses, not to stay indoor too much because of that bacilli. The bacilli can stay in the air for so long. They open their windows. In the facility, we'll do health education. Yeah. If you're sick, come seek early treatment. Early treatment prevent others from getting it. Yeah.
All right, and we have a caller. We have Lucy from Kisii. Hello, Lucy.
Hello.
Hi, how are you?
I'm fine. I'm calling from Kisii.
Right.
So I wanted to ask the doctor if there is a relationship asthma and TB.
All right.
Because when sometimes you cough, there is vitu kama makamasi zinatoka. So is there any relationship?
Okay, thank you, Lucy. She's asking about. Okay, she's asking whether there is any relationship between TB and asthma.
And asthma.
Yes.
I'll talk mostly on children and also adults. You know, cough is one of the key signs of TB. I think she never maybe got it earlier. When you cough, any kind of cough, it could be TB.
Right.
And there are other differential diagnoses of TB. Maybe it was not mentioned earlier. And asthma is one of the differential signs of TB. But one thing with asthma, The cough, you can tell asthmatic cough. Maybe you cough a lot at night, yeah? And one thing with asthmatic cough, you take those inhalers, the cough disappears.
Right.
But with TB, you can take inhalers, the cough is still there because it's bacterial form of disease. While asthma is an allergic cough. Yes.
And
sorry.
Yes, and that leads us to the next question. Yes. You've talked about you cough, you know. So is it a lifetime disease, or is there a way it can be treated and cured?
TB. TB is treatable, is preventable, and is curable. Yeah, as I mentioned, the drug-sensitive TB, you know, Chichi suffered a different kind of TB. He had the sensitive type of TB, then resistant pattern of TB. The drug-sensitive TB, we usually treat it for 6 months, and one is completely cured of the disease. Yeah, if you have the resistant pattern, it depends on what drug resisted, but the MDR, the one Chichi that suffered, we have the shorter-term regimen. He was unlucky. By that time, we never had so many cases during his time.
Right. And
so,
Doc, please kindly allow me to cut you short.
Okay.
Let's receive this call.
Okay.
All right. Hello. 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 I think we've lost the caller.
Oh, sorry.
Yes. Hello. Okay, maybe she'll be calling later.
Yes.
Yes, you're talking about how to treat TB.
Yes, yes. The normal TB, it's usually 6 months. The resistant, dependently, but the multi-drug resistant, nowadays you are treating it for 9 months with injection.
Right.
Chichi, before that, we were using injection for drug-sensitive TB, but currently we don't use injection for drug-sensitive TB. We just give full treatment for 6 months.
All right.
Yes.
And Chichi, what's your message to people with the same symptoms that you had, or people with TB, but they are facing a lot of stigma because this is something that you've been able to overcome, right? So speak to those kind of people. TB patients, they're facing a lot of stigma. They do not know what to do.
One thing, some patient, let me call them patients.
Yes.
They must understand that TB is inside them. It's not inside the doctor. It's not inside anybody. So it's his or her burden, you understand? He has to bond.
Right.
Whatever somebody's talking, whatever, how you're being treated, I think you have to put an ear band and never listen, and you just ignore, you understand, and move on. That's the only secret, a weapon. You understand?
All right. Yeah. And Doc, just before you get to your parting shot, there's someone who is asking a really important question. Can surgical masks help us when dealing or handling patients with TB?
Is that I think is a healthcare worker.
Yes.
And I'll talk about the different kind of masks that we have. We have the surgical mask, the normal one that, if I can say it in a layman language, the one that they use in the theater, the green one. Yeah. Those basically prevent from the person who is wearing from emitting the bacilli. The surgical mask, basically we give it to the patient because we don't want them to emit a lot of bacilli to the larger population. For a healthcare worker or maybe a caregiver, we usually give them N95 mask, which is very well it protects the wearer from inhaling the bacilli from outside. So surgical mask for someone who is not a patient, I think it's not good. You need to wear the N95, which prevent you from inhaling the bacilli from outside.
And quickly, as we wind up, I think the parting shot now should be, how do we deal with these patients at home?
We are not supposed to be scared. You know, sometimes we stigmatize them, separate their things. We need to love them. Yeah. The only thing you need to understand, because we usually have treatment supporters. When we get a TB patient, we have supporters. We educate them about the disease. When they go home, they need nutrition. Nutrition is very key. As I said earlier, these drugs are very heavy, and sometimes they deplete some of the nutritional supplement. So they need to have maybe good nutrition, balanced diet in their home. They need at least to stay outside. You know, infection prevention is very important. We don't want to infect other people. You need to open the windows back at home. Yeah. Health education is also very important. If you have the young ones, we usually say the young ones, and if you have a TB patient in the home, you come, let be screened for TB, and we usually give them the preventive therapy, the young children who are exposed.
All right, Dr. Elizabeth Mweni, TB coordinator for Nairobi County. Thank you so much for coming to this show.
Thank you.
And Eliud Chichi, TB champion, thank you so much for allowing us have you here today. And that's all the time that we had for the show today, but we've really learned a lot. And thank you all for watching. Something important to note is that TB is airborne, anyone can get it, but all you need to do is ensure that your lifestyle, check on your lifestyle to just boost your immune system. My name is Purity Museo, and thank you so much for your calls. Thank you so much for your comments. Remember, you can always watch our previous episodes through our YouTube channel, that is Ebru TV Kenya, or my personal channel, that is Purity Museo. I'll see you again tomorrow.